3부의 세 번째 발표는 케이지로 사쿠님입니다. 일본 키에츠카이 나카가와 병원장이자 후쿠오카 대학교 명예 총장이신데요. 오늘 HDL과 죽상 동맥 경화증에 대해 발표해 주신다고 합니다. 네, 큰 박수로 맞이해 주시기 바랍니다.
President of Fukuoka University
Thank you
College of
very much.
Medicine. Today, he's going to
Mr.
make a
Lee, thank you
presentation
very
about
much for
HDL
giving me a
and
chance to
atherosclerosis.
speak at this meeting.
Please welcome him with a big round of
In
applause.
such a beautiful city, Seoul. I am Dr. Saku from Japan, and I just want to talk about HDL. Usually, obesity men carry a lot of abdominal fat and produce free fatty acid or many cytokines. And I hope you like it. And free fatty acid released and enter the portal vein and then go to the liver cell and produces VLDL. This introduces a metabolic syndrome. Just a minute. So, okay. Recently, this is being called the cardiovascular kidney metabolic syndrome, CKM. And this is the same as metabolic syndrome. Small amount of free fatty acid makes a small amount of VLDL in the intravascular compartment. And lipid transfer, VLDL TG transfer to HDL, and HDL cholesterol ester transfer to VLDL through the CETP. These are very slow process in normal people or high HDL cholesterol levels. This intravascular style is very slow process. Okay. Then a lot of free fatty acid released, and especially CKM, then larger VLDL are produced, and the intravascular compartment lipid transfer is very accelerated, very fast. HDL is likely to be TG-rich lipoprotein, and it destroyed very easily and faster. TG-rich VLDL makes a small, dense LDL because this is a very TG-rich and action of lipoprotein lipase and become a very small LDL. And it's not clear by the LDL receptor and always circulating and oxidized and deposited in the artery. This is 40 years ago when I took my fellowship in Cincinnati, Ohio. We draw blood from many patients, the cardiovascular disease and nephrotic syndrome or low HDL cholesterol, or usually normal controls also, and isolated high-density lipoprotein and label it I-125 and re-injected intravenously. It's a very wild experiment, but it was permitted ethical committee, and drew the blood periodically for 2 weeks, and we isolated HDL and isolated ApoA1, specific radioactivity of ApoA1 and A2 was plotted. So we found that the decay curve HDL is shown in the people with HDL, normal HDL cholesterol, but very faster, steeper in a patient with HDL deficiency or HDL, low HDL cholesterol levels. And we also measured the HDL particle size. And particle size in coronary artery disease patient is much smaller than that in normal control. So from this data, this is 25 years ago in JAG. So reduction in HDL cholesterol concentration and reduction in HDL particle size are additive effect on the coronary artery disease incidence. So from these two data, we raise one hypothesis, HDL warrant hypothesis. No depth, no trouble, no plaque. It's a slow movement. Take a free cholesterol and return to the take a cholesterol and a little bit return to LDL, and LDL clear by LDL receptor. It's a very slow process, like a rich person who must to have a huge amount of money and only use a few percent of his asset for the presidential or prime minister campaign. So this is a very slow. However, once you have a lot of debt means a lot of plaque. HDL has to work, and always take a cholesterol, and then transfer. This kind of, so it's just like if you took out a loan to buy 900 million Korean won mansion, you have to work every day. And you receive money, but you have to return to the bank. So it's this kind of, so always wallet, no money. This is atherosclerosis mechanisms. So we reported a two-step reverse cholesterol transport hypothesis, fast and slow. We proposed two steps reverse cholesterol hypothesis. First step of taking free cholesterol is good, but second step involving the transfer of lipid, if the acceleration of lipid transfer causes lipid accumulation in extrahepatic tissue. This second process is a very problematic at this point. Why you think so? This thing. Just there's no depth. The HDL is a very slow process, but once you have a depth or plaque, you have to always and return to the bank money. So always varieties, no money. This is a two-step reverse cholesterol transport. So why you think so? Because 20 years ago, CETP inhibitors seemed to be very potent and promising drug for the prevention of atherosclerosis by increasing HDL and decreasing LDL cholesterol. So we decreased the extra hepatic deposition of cholesterol, which means stop paying money to the bank. So really, 20 years ago, we expected CETP inhibitors. However, all CETP inhibitors tested to date have failed to show good result. I was primary investigator for the evacetrapib trial in Japan, and HDL cholesterol going up, maybe 58%, LDL cholesterol going down, 33 or 34%, especially in Japanese. This effect is more potent in Japanese compared to the non-Japanese. I don't know the reason why, but these are, all declined. And Pfizer's torcetrapib raised blood pressure. As you know, this is the off-target effect or something like that. So anyway, so HDL targeting therapy, maybe CETP inhibitors failed, but it's very similar to the policosanol, decreasing LDL cholesterol and increasing HDL cholesterol. And Dr. Cho reported Rayleigh's policosanol inhibited HMG CoA reductase and also the reduced CETP activity. So what the difference of the policosanol and CETP inhibitors? Maybe plant a product and no side effect in functional food, and also decreasing blood pressure. So it's a merit. We need more study or research for it. So HDL targeting therapy, there is three: the lifestyle change and small molecule HDL therapy. I just want to talk about the A1 disc and the A1 mimetic peptide. I think probably policosanol location is positioning is maybe lifestyle and small molecules, something. And most important point is lifestyle changes. Changes lifestyle are very important. HA, ACP, and ACC have reported life essential age. So, but before I talk about ApoA1 disc mimetic peptide, I just want to show the mild exercise lifestyle. I've been working with this lady, is the CEO of 10 Minutes Lunch Fitness. I've been working more than 25 years with this lady, Miss Moriyama, and always exercise together and exercise promotion awareness, HDL. This is the Dr. Saku's HDL exercise. I just like to show you this.
Dr. Saku, Dr. Saku, HDL. Dr. Saku, Dr. Saku, HDL.
Do this 10 minutes and 180 kilocalorie you can burn it. So these are the most important point. When you have this kind of meeting, I always ask the audience to stand up and exercise just a little bit. But this is very good for the lifestyle, change. But anyway, I just want to talk about ApoA1 disc. The ApoA1 and phospholipid make a disc. And people call this is a fence. This is a bundle. Maybe bundle is a more common. Then many years ago, more than 20 years ago, and I was talking with Roger Newton and Brian Krause about the ETC 642. This is a phospholipid and ApoA1. And but it was a Esperion group and licensed out to the Pfizer. So I worked with Pfizer. We injected ETC 642 intravenously into WHHL MI rabbit. This is a model of a homozygous FH prone to myocardial infarction. This rabbit, total cholesterol is 1,000 milligram per deciliter and a lot of xanthomas. And dying with myocardial infarction. And ETC 642 was injected twice a week for 3 months. we then look at atherosclerosis in the descending aorta using IBUS. This is IBUS. This rabbit total cholesterol is 1,000, so the atherosclerosis is very, very sick here. Then we put back, usually IBUS is used for the human study, but rabbit IBUS is very difficult. We need a very high technology, but we can do 3 times. One is the right femoral artery, and second one left femoral artery, and third one bifurcation of aorta. But we can see this. Then this is the changes IBUS plaque volume in control and low dose and high dose ETC 642 after 3 months in a rabbit. As expected, WHH MI rabbits show an increase in the plaque because 3 months is enough to make a further atherosclerosis. However, high dose of ETC injection significantly reduced the plaque volume. So this is also the integrated backscatter IBUS. The composition of plaque is a drastically reduction of lipid pool, blue, and increased fibrosis, green. So I was very very good feeling to the ETC ApoE1 disc, but I don't know that the going on. Maybe the Pfizer's shelves, it must be there. But anyway, so, but full-length ApoE1 is very difficult to make it. So we have a mimetic peptide. We call this a FAMP. Fukuoka University ApoE1 mimetic peptide. We call this a FAMP. Then we selected the sequence of ApoE1, the last portion of ApoE1, which is very important for reverse cholesterol transport. FAMP consists of 24 amino acids, and it has a very strong alpha helix structure and produces pre-beta HDL. So we used this, and we did many things after injection of FAMP, and atherosclerosis actually reduced, and also the macrophage specific reverse cholesterol transport was enhanced by FAMP, ApoE1 mimetic peptide. Free cholesterol excretion was going up after treatment of FAMP. So this ApoE1 mimetic peptide going to the plaque. Then we thought if it is radio-labeled, and plaque will be appeared, illuminated, so that we label it gallium-68 with ApoE1 mimetic peptide, FAMP. Then intravenous injection and PET imaging we did. This is a normal rabbit, nothing illuminated, but this is the total cholesterol 1,000 WHH rabbit, nicely illuminated. And also this is a stent was inserted in the WHH rabbits, very strongly illuminated. So we call this is a molecular imaging of atherosclerosis. So anyway, HDL is a very critical target in the treatment of atherosclerotic cardiovascular disease. There currently only a limited therapeutic option to increase and enhance the function of HDL. We have developed ApoE1 mimetic peptide, FAMP, which has anti-atherosclerotic effect through the enhancement of reverse cholesterol transport. And we achieved a sensitive molecular imaging atherosclerotic region using FAM. Thank you very much.
네, 지금까지 케이지로
So this was a presentation by Professor Saku. If you have any questions, please raise your hand.
마이크 전달해 드리도록 하겠습니다.
Good afternoon, sir. I'm Astos Bahugna. So, sir, I want to know that APO mimetic peptides. So, what is the selection criteria for the criteria for the APO mimetic peptide? And is their affinity or the functionality is much higher compared to the native APOA1?
Native APOA1. Yes, I think so.
Okay, sir.
Yes.
And what the criteria we are taking for the selection of the APOA1 mimetic peptide? As we have different kinds of the peptides, this one APOA1 mimetic peptides. So what are the basic criteria when we are just constructing these APOA1 peptides?
This is a very important, difficult to answer, but we are making a 24 amino acid.
Okay, sir.
Okay, but we should shorten this one because of very costly to make it.
Yes, but in general, they have much more effectiveness as compared to the native HD.
I hope so. Yeah.
Thank you, sir. Thank you.
네,
Any other
감사합니다.
questions?
또
Please
질문
raise your
있으신 분
hand.
계시면 손을 들어주시면 감사하겠습니다.
Without further questions, we will conclude his presentation. Please give Professor Keijiro Saku a big round of applause for his excellent presentation. Thank you very much.